Centre. This is part of your campaign to try and get people to come out and avail of the walk-in centres this weekend, is that right?
What I want to do is I wanted to come to Limerick and to as many other vaccine centres as possible. And first of all, just acknowledge the incredible work that is going on. This is, without a doubt, the most important and successful public health programme Ireland has ever run. I think there's growing awareness that it's actually one of the most successful vaccine programmes anywhere in the world. And a large part of the reason for that is the men and women working in here and working in our other vaccination centres. The HSE have been incredible, and there's been a level of cooperation between hospitals and community care that is unsurpassed. But it's much more than that. What we're seeing here today, we have the Red Cross here, we have the Defence Forces here, we have the Gardaí here today, we have volunteers here today, we have students, we have doctors. It's a national effort. It was described to me earlier on as a war effort, and in a way it is, fighting against this disease. And I'm just immensely proud of everybody who's involved in this. The experience people are having when they come in is fantastic. People are coming in, they're being listened to, they're being treated well, it all flows very, very well. If people have concerns, if they have questions, the team here are helping them. And I've no doubt that part of the reason for the success of this programme is because people are coming to places like this and they're going back and they're telling their friends and they're telling their families, you know. And what I'm really encouraged by is how so many younger people are turning up. There's been a huge interest. We opened the portal some time ago, obviously for 18 and up, and then earlier this week for 16 and 17 year olds. And it's wonderful to meet 16, 17, 18, 19 and up. They're excited to be here. They're excited about getting themselves protected. They're excited about making sure that their friends and family are protected. So first and foremost, it's about just acknowledging what is just an incredible national effort that I know the whole country is really proud of. And then secondly, exactly as you have said, to say to people who haven't got themselves vaccinated yet, come forward. It's really important. It's going incredibly well. It's how we defeat this virus. It's how we get back to normal. And then right across the country, all the details are up on the HSE site. Over the bank holiday, there's walk-in centres for everybody. So if you've already registered on the portal, doesn't matter, you can turn up and you'll be sorted. If you haven't registered, turn up and be sorted. There's things you need to bring, like your PPSN and photo ID and so forth. All the details are available online. And I would just encourage everyone who hasn't yet got around to getting vaccinated to either go to the portal or come to one of the centres like this over the weekend. It's a really, really positive experience.
Minister, there's a suggestion that there is a narrowing of the time period on second dose vaccines from 4 weeks to 18, 19-day periods. Is that happening, and why is that happening?
Yeah, that is being looked at now. I don't want to stray into the realm of the scientists and the experts, but these things are happening. And you know, where we saw it as well was with AstraZeneca. So we started out at 16 weeks. We then got advice to bring it to 12 weeks. We then got advice to bring it to 8 weeks. And I think the important message for the public in all of this is we're getting fantastic expert advice from NIAC all the time. So a few weeks ago I asked them for their view on the European Medicines Agency's authorisation for 12 to 15 year olds. They spent a huge amount of time looking at this, and we got this wonderful news on Monday that we can proceed with the 12 to 15 year olds. It's been interesting listening to some of the vox pop. So the children themselves, a lot of them are saying they're very excited about it. They want to get vaccinated before they go back to school. A lot of parents are relieved that they're going to be able to bring their children in, get them vaccinated. And then there's other parents and other children who very, very understandably have a lot of questions. You know, parents will always do the right thing for their own children, and we're going to make sure that the information is up there, that the experts are available. So all of these movements that you're talking about in terms of interval, all being expert-led, and it's all been moving in the right direction.
And is that narrowing actually happening on the ground now, or is it just being spoken about? Is it happening in vaccination centres?
I know in certain cases it is, but I prefer to get you the latest from the HSE on that. So I want to be accurate on it. But certainly it's all moving to a place where we're getting more and more people vaccinated. We've now surpassed the European target of 70% fully vaccinated. There aren't that many people who would have thought just a few months ago that in July we'd be vaccinating 16-year-olds, and isn't that fantastic?
Are you worried about international travel coming into Ireland? are there any spikes, noticeable spikes in any part of the country with that?
I tell you, the security measures that Ireland has had in place have tended to be the joint strongest or the strongest in the European Union, and it has stood us very well. So, for example, the way our Delta wave started a good bit after the UK, that is partly because of the measures that we had in place. So we are seeing some spikes around the country, as we know. There are cases linked to travel, we know that. Now, most of the cases we're tracking are Irish people going abroad and coming home. Unfortunately, there was a certain number who left before they were vaccinated, before they were protected. They shouldn't have done that. Some of them have come back, unfortunately, and they have contracted COVID. But look, we'll take care of them. We'll make sure they get the care they need. But really, if people are following the guidelines, right? So if they have their digital COVID cert or they get their PCR test, the advice we have from public health on that is strong. Now, public health would say if you have a PCR test rather than being vaccinated, the public health advice would be still do the 5 days at home, just to be particularly safe. But really, it's not being driven by international travel. It's a contributing factor. It's being driven by all sorts of different things, and the response is twofold. Everybody get vaccinated and then keep following the public health guidelines.
Just sticking with COVID, I understand that indoor childcare facilities are still not open. What's the advice on that? When will they start to reopen, and when can more numbers attend funerals and religious ceremonies? I know you said that 100 people can attend weddings, but
yeah.
What about the rest of the religious ceremonies?
So what we'll do is we'll follow the same process that we always have. NEFIT will keep looking at the data, at the epidemiological situation, numbers vaccinated, how the disease is going, the patterns of the outbreaks. They'll advise me, and government COVID committee will meet, and we'll make those decisions every few weeks, as we have been doing.
And what's the advice at the moment on funerals, christenings, and indoor child facilities?
So the advice hasn't changed. All of that advice is up online. In the latest round, what we did was we made an exception for weddings, moved weddings from 50 to 100, and then baptisms as well. But all of those others are as it has been on the website. There's been no change there, hasn't there?
Minister Lofty, are you concerned about the recent outbreak of COVID-19 in the Limerick town of Kilmarnock, which has been largely attributed to hospitality settings?
So we've looked at this, and the advice that I have is that there was what is called high risk activity going on. You know, people not wearing masks, maybe people who weren't fully vaccinated. Things like this happen all the time. They happen all over the country. Different towns, different villages, different counties have seen spikes. I think it's important we recognise that with the best will in the world, things like this are going to happen. And the message to people is, if you were there, go and get yourself tested. If you think you might be at risk, go and get yourself tested. It's all free, it's very quick. If you are symptomatic yourself, contact your GP and book in for a test, and then obviously isolate yourself in the meantime. I think as more and more people get themselves vaccinated, these outbreaks should become less and less. But the appeal from me would be to just keep following the public health advice. It's not bulletproof. People will still get COVID, we know that, but it will help with some of these bigger outbreaks.
What do you say to hospitality businesses that aren't necessarily adhering by COVID-19 rules and the regulations?
I think the vast majority of the hospitality sector is adhering to the rules. The hospitality sector, they've had a brutal time. They really have. And it was really important to us that we were able to get people back to work. We had solid public health advice on people who were fully vaccinated or recovered. So for the hospitality sector, they want to run their businesses. They want to take care of their staff, make sure their staff are safe. They want to take care of their patrons, make sure their patrons are safe. The vast majority of businesses are running like that. If there are a few outliers, which we have had in the past, who've decided that they don't need that, they shouldn't be doing that. They're putting their patrons at risk. They're putting their staff at risk. And I certainly would urge them to stop doing that immediately. But I want to recognise that the vast majority of the sector are doing exactly the right thing, as they have from day one.
The situation at University Hospital Limerick, the INMO asking you to take a look under the bonnet, despite 100 beds opening since the start of the year. they've had to cancel elective procedures, shut down outpatient clinics this week as numbers rise, and 50 on trolleys again today. Are you going to commit to any kind of ministerial intervention, any kind of review of what's happening at that hospital?
There's been a review, and what the review said was...
It sounds like there's a need for another review, if you don't mind.
Well, what the review said was what it has said, and what I would agree with right across the healthcare system, which is we need more nurses, we need more consultants, we need more beds, we need more diagnostics, we need more home care. A lot of that was put in place last winter, so we launched a €600 million winter plan, and in spite of COVID, which should have made the trolley crisis much worse, we didn't have a trolley crisis last year, including in Limerick, and that is thanks to the huge work of the clinicians on the ground and the hospital management. So what have we done so far? There's a second MRI machine went in, I think about a year and a half ago. In October, we started opening up these 98 beds. We've also sanctioned an additional 34 or so consultants. A small number of them are now in place, but the hospital is looking to recruit more, and we've significantly increased the home care budget very significantly this year. So the hospital is aware, and I'm aware of what the problems are. We know why this is happening, and we are responding to it. What I want to see is more nurses hired. We want to see the safe staffing framework in place right across the system, including in Limerick. We want to see these consultants in post. We want to see the diagnostic capacity expanded, and we want to make sure that the GP community have all the resources they need to lead on chronic disease management. What's happening in Limerick at the moment is something that the medics have been warning about right across the world in terms of COVID. So what we're seeing a lot of older people coming in. There unfortunately is deferred care, so they are sicker in a lot of cases than they might otherwise have been. They're staying in hospital that bit longer, and that's putting the system under a bit more pressure. So in terms of, do we need a review to know what we need to do? I don't think we do. I think we know what's needed. What's needed is more resources, and I think the hospital are doing everything they can to that end.
I'm told that around 50% of emergency department nurses have left since the start of the year. Retention is very difficult in the conditions that they find themselves working. So how do you intend to recruit more if you can't keep the ones you have?
Well, they are recruiting. I think several hundred extra nurses have been recruited in recent times. So they are recruiting, but we do need to acknowledge that for nurses, for doctors, for allied health professionals, for administrators, for everyone who has worked in the HSE over the last year and a half, they've had an incredibly difficult time. I think they have represented and continue to represent the very best of us. Every single time they've stepped up to the plate. When the rest of us were told to stay home to keep ourselves safe, they went into hospital. They went into Limerick Hospital to keep other people safe. We need to recognise that, and we need to recognise that the current staffing levels are not sufficient. The INMO is bought into the safe staffing framework. They're very enthusiastic about it. I'm very enthusiastic about it, and we are rolling it out. And as we roll out the phases of the safe staffing framework, particularly for the nursing profession, it's going to go a huge way. But we need to recognise that they've had an incredibly difficult year. We need to be very aware of that, and we need to listen very carefully to the frustrations that they have.
Will that be recognised with a financial bonus?
I want to see something done. Yeah, absolutely. I really do. I think our healthcare teams have just been incredible. We're still fighting the fight at the moment, but I definitely want to see some form of recognition for the extraordinary work that they've all put in.
Okay, thanks guys.
Thank you so much, folks. Cheers.